Hello, my name is Isaiah Hernandez, and today I'm going to be discussing an article that addresses the following research question. For patients undergoing surgery for a full-thickness rotator cuff tear, is an all-arthroscopic procedure superior to a mini open procedure relative to pain resolution and improved function post-operation? So the population here is patients with a full-thickness rotator cuff tear. The intervention is all arthroscopic procedure compared to mini open procedure, and the outcome is pain resolution as well as improved function post-operation. So to find an article that addressed this question, I went to the PubMed online library and I searched rotator cuff repair and arthroscopic and open surgery and decreased pain and functional outcomes. This yielded 17 hits, and after reviewing the list of 17, I found that the third option on the list included the most relevant info related to the research question, as well as the best follow-up period with consistent data. So this article took 50 subjects and split them into two groups, 25 in an arthroscopic group and 25 in a mini open group. These subjects were randomly allocated to those two groups, and the inclusion criteria was patients 20 to 65 with a clinically diagnosed full-thickness rotator cuff tear, confirmed by an MRI, and having a healthy contralateral shoulder. The exclusion criteria was patients with a massive tear greater than 5 centimeters and any sort of associated shoulder pathology, so adhesive capsulitis, arthritis, previous fracture or history of surgery on that arm previously, or even labral pathologies were all excluded from this study. Both groups performed their surgeries in their respective groups, and then following their procedures, both groups performed the same rehab program following surgery, and there was a follow-up for a 1-year period at 2 weeks, 4 weeks, 3 months, 6 months, and 1 year. The researchers found that there wasn't a significant difference between the groups at the final 1-year follow-up period. So pain, range of motion, function wasn't a great difference in results at 1 year, but they did find a somewhat significant difference in the earlier stages of rehab. So around that 3-month period, they found that patients in the arthroscopic group showed both better range of motion and a significant decrease in reported pain for that early phase of rehab. So I thought that was an interesting finding. I did think that this article had pretty good inclusion criteria for the study, and I like that they blinded their subjects to which procedure they got. And then I also like that they all performed the same rehab plan. So I think they did well just eliminating rehab factors from potentially being more of a factor in the improvement of the subjects. They did well just trying to make it focused on which surgery might have better outcomes. So in addition, I found that the consistent follow-up for a year, there was 5 separate occasions where they were doing follow-ups and getting objective data. So I think that also helped with the validity of the study, despite it being a smaller one. Outside of the smaller subject pool, I did think that a longer follow-up period over multiple years would also be very helpful and give us probably a better idea of kind of the more long-term outlook on these surgeries as well. So as far as the application to this article, I used the case that involved the rotator cuff repair and the arthroscopic rehab protocol. And so I just think having information and data and studies like this is helpful in the aspect of patient education. I think obviously it's really important for a patient going through one of these procedures to know what the procedure is like and what the prognosis is. And specifically for that case, with it being an arthroscopic patient, I think it's helpful to be able to use a study like this and be able to say, you know, it's a rehab-friendly procedure, and there's cases where research has found that some patients have even improved their range of motion and had decreased pain earlier in rehab. I think those are just things that we can use to not only educate the patient, but also motivate them and encourage them, and to just help them feel good and confident in their recovery journey and what they're trying to accomplish. So overall, very helpful article, and hopefully more research in the future can use larger pools of subjects and follow up for multiple years.